Hello, all. This is Ovais and Sol. Welcome to Humanist Chat, episode 3. Now, today, Jonathan is not joining us, but I am joined by our new co-host, Sol. Tell us about yourself.
I am currently working in an ICU at a level 1 trauma center. I thoroughly enjoy nursing and everything that comes with it, even the bad stuff. But I look forward to discussing some humanist values and how that relates to our very difficult job and how we can sort of broaden the ideas of how being a humanist can work just as well in healthcare as any other field.
But question: have you always identified as a humanist, like as far as your workplace, or?
I feel like I was a humanist without knowing I was a humanist until I discovered it, because there's I always went to work with the idea that I'm just gonna do the best for my patient, no matter what it is, and that's just my goal. So then my my own core values after leaving religion just kind of evolved into a humanist perspective as doing good for humanity and doing good for the world and doing good for our patients. And so, yes.
So this is a question I want to ask you specifically as a white person, and that is because I get this as a Pakistani person. When you're in the workplace, do you feel like people just automatically assume you're a Christian just because you're a nurse?
Yeah, I do think that I've had, patients and physicians, make me pray with them, and, I'm respectful to their wishes. Not that I particularly want to do that, and I don't find it to be helpful, but I suppose if it's helpful for them emotionally, then fine. But yeah, and one woman was telling me all about her religion and how she felt bad for people who didn't have religion and how sorry she was that they don't have that. And I was like, okay. So yeah, I feel like right off the bat, people assume that I'm just of a religion, especially pretty much always Christian, because that's the dominant in at least my area.
Yeah, and the reason I mentioned your skin color is because I kind of feel like people do have that weird prejudice. Like when I in nursing school, people just automatically assumed I was Muslim, and like when I was just like, oh, I'd like a bacon cheeseburger, and one of the people was like, wait, aren't you Muslim? It's like, no, I'm an atheist, and it was just like, whoa, like what? So it's I kind of wonder if Jonathan because he's a military nurse,
Mm-hmm.
how his experience will be different from ours. Because I kind of, even though I was in the military, I don't know like if that medical setting, if religion isn't heavily like expected, but like for us, I figured it would we would have this civilian nurses have it more like pushed on them.
Mm-hmm.
I think there was a book by Christina Wilheimer Smith. I can look up the name, but it's a book called "Nurses Are from Heaven," and there was a line like just as there's no atheists in foxholes, there's no atheists in nursing, and you know, and I don't know if people like really understand that one, that there are many atheists in nursing, and two, we do face forms of discrimination, just like a fear of coming out, like in a weird way.
Even having this conversation, I was like, I need to go somewhere where there's not going to be any people, because I don't want to, them to hear me talking about this topic. But it's still, even just a conversation. But it still does feel like you shouldn't say these things in public and whatnot, even though it's nothing to be ashamed of.
Definitely, and if any point you need to want to switch the setting or anything, let me know. Yeah, but that's definitely a good thing to point out, because it's in my I'm currently pursuing a higher degree, and even then, I think I'm being told a lot, like my professors and faculty, that always thank God for what you're doing or where you are, and uh, and that's that's like constantly, I feel like, expected, and it's just like I feel like only nurses have to deal with this, you know.
Can I tell you that I applied for grad school as well, and I want to do an in-person setting because, you know, I'm going for acute care nurse practitioner, so it's difficult content. I do better in a classroom environment where I can make friends and have that study group and those core people that I can move through the program with. The only one that offers an in-person within like 2 hours from me that's not $1 million is a Christian school, and a theology class for nurses is required at a graduate level.
Really?
It's extreme. Like, we can, you know, we can have this discussion later too, but the course description is, what does it mean that people are created in God's image? How does sin affect our relationships? Why do God's people suffer in the world? What is the key to human redemption? How should we approach caring for the hurting and dying? In an effort to answer these questions from a Christian worldview, this course integrates interdisciplinary insights from the fields of Christian theology and nursing.
Wow,
It's
is
real extreme, real extreme.
that's that's wild, you know, like wow, you know. I guess some of those things I would like the answers to, but wow, I mean, that's it.
I'm not looking forward to that class at all, but kind of am interested just to see what it's going to be like, because I feel like I'm not going to be able to even say that I don't have a Christian worldview, let alone an atheist worldview, you know, or an atheist worldview, you know.
Like,
I don't.
well, you know, so I think you know, so that kind of like brings us into the topic is you know, and what we want to focus on for this conversation is what can we do for nurses who work in such a religious setting, because you know you can work in a nonprofit hospital, you can work in many hospitals where I guess it's safer to come out as an atheist. However, last year there were court cases passed concerning the ministerial exemption law, which is, you know, um, in the it was two Catholic schools. I'd have to, I'm gonna upload the links to those cases, but you know, two teachers were fired and couldn't sue for discrimination because the Supreme Court decided that the teachers' positions in the Catholic schools were ministerial, even though they were just teachers. And you know, and one of the dissenting opinions, and I think it was from Justice Sotomayor, said that if this happens, this is going to put nurses, other people at risk. So you know, I've worked at a religious hospital before, where when you're getting report for all the morning huddles, you start with a prayer. So what do you think? Like, so what do you think the implications of this are for atheist nurses in these settings?
I feel like it puts not only us atheists, but also any non-Christian religious faculty at risk for being dropped because of their beliefs. And this is such a blatant way to hide behind a loophole, really, to keep your echo chamber echoing loud. I would be fearful that anything I ever did wrong would be just scrutinized even more deeply than someone who was a Christian at that type of facility.
Yeah, like you think like more like you know, we obviously know that there is I know big thing in nursing that's going around, nurse bullying, they said. But like, you know, like, okay, you made this error, that error. And it's like, yeah, you're looked badly upon for being an atheist.
Mm-hmm.
That, you know, and I think like, so do you think it's what do you think as far as like promotions would go in that hospital too? Or in those certain hospitals? Do you think that that would be affected as well?
I would think that would be that I feel like that would be a deciding factor. It's like you have all the qualifications and all the credentials and all the experience, but you don't have a Christian worldview. So the person who's right behind you is going to get that instead. And even I applied to a few schools. One was Catholic, one was Christian. And both of them asked me to list my religious affiliation or whatever. And not that atheism is a religion, but there was not a atheist or a nun answer to choose from.
You know what? I actually had that same opinion. Actually, had that same situation happen when I applied to that religious hospital, and yeah, I mean, how do you think like that makes so? How do you think like that makes us like feel like? Because for me, it's like, wow, you really can't come out. Like, you kind of feel in a weird way trapped, and and why do you think this is? Like, why do you think that the assumption there is just that you're Christian? Do you think that they assume kind of like that lady's book where it says there's no atheist in nursing? Do you think that that's just an assumption that people just think, well, atheists don't exist in nursing at all?
I think that they think that since we don't have a text to tell us how to act and how to be and what's right and wrong, that we're just, living in the gutter and doing whatever we want and not caring about how other people are affected by our actions. And in reality, especially with a humanist perspective, that's all that affects our actions, is how it affects others. So I think that people assume that that atheists just have no morals and no standard of how to treat people, and they just do whatever. And
Well, and I agree. I think that when it's like weird because I think people are like with nursing, it's just like, well, it was started by Florence Nightingale, who was religious, and it's just like, so why would somebody who has no morals or like no book to tell their morals be in a profession like this? Why would you want to help other people? I always find those things kind of hilarious. but do you think that perhaps like that these nurses probably also, like the nurses who are secular and atheists, like I find like I couldn't really even talk to the chaplain about like certain things. I found it in a weird way difficult to talk to patients who were also atheists, because if you kind of tell them like going on, like if you tell them like I'm also an atheist, and especially like people in critical care like where you and I were, a lot of times they are going to pass away, and when you're in agreement with the patient that there probably is no afterlife, they act in a certain that you can't say that out loud, because everybody else around you is just like, we're going to pray for this patient, they're in a better place and things like that. Have you experienced that same thing?
I have not ran into any patients that were outwardly atheist, but I have a very big extended family, and she's technically my first cousin once removed, or whatever, however that works. She did pass away from cancer recently, and she was never religious, her husband's not religious, their children aren't religious. And so I feel like although she was okay with leaving this earth and whatever, he's been really struggling with the fact that he's never going to see her again, which is really hard. And we're all really close knit. And the only solace that I could really give him is that he witnessed it firsthand how much pain she was in from treatment and whatnot. So if I can give anybody any relief, it's that the person is not suffering anymore. And even though we don't get to have them anymore, we can hold on to the memories and the feelings and the videos and that we have of her. And that's exactly what I would say to another family member, another patient's family, or to the patient themselves, that that their family won't forget them, even though they're gone, and that's it, and they're not going anywhere else after this life. That their memory will still be alive with all of them.
Yeah, and I agree. I agree with that. That's and I think like if when you say that kind of in a more public setting, that does sound it sounds harder and harsher, like from a I guess from a religious standpoint.
Hmm.
I kind of always go to my view of the what happens after we die as from that show, The Good Place. With I don't know if you remember if you've ever seen it with Kristen Bell. Um,
I don't think I have.
so they bring in a Buddhist philosophy about like explaining that a that if you think about life, it's like a wave. You can for a while measure it. Uh, you can see it move. You can see parts of it, but then the wave crashes into the rock and it's gone. But the water remains. It goes back to the ocean where it belongs. And that I kind of like that to think about it in that kind of philosophy of how I explain that to people.
Mhm.
It's like even in the even in the hospital setting, it's hard to definitely get there. Like it's hard to tell people like you're a nurse who believes in that because it's like if you can't come out and say like this person's in a better place, then it's like you're looked down upon. Like how could you be taking that hope away from the patient? Like yeah,
And, and how far are we supposed to go with participating in, you know, ceremonies with the family and whatnot, because there's been some, I've cared for them many days in a row. This is the end, and they were thankful for all that I've done for them, and they want me to be with them while all the other things are going on. And it's like how far do we participate in those kind of rituals if they wanna pray together, or they wanna, I don't know, whatever, do whatever. It's like, am I supposed to just, you know, bow my head, close my eyes, all this stuff? Because I don't do that now when I'm involved in a prayer, like at dinner or anything. I don't do that now.
definitely. But one thing thanks for bringing that up. So for our listeners, please in the comment section, if you work in a religious hospital and you'd like to ask us questions, please put it in the comments, and I'll put my email out there, my Humanist Healthcare email, and you can email me and we'll bring them up on the next show. But so with you bring that, like, so what can we say to that nurse? That nurse that's like, I'm not religious. I haven't come out to my coworkers, um, but I'm taking care of this family member. They're asking me to pray with them. They're asking me to say things like, um, I feel compelled to say things like their family member's in a better place. You know, should I lie to them? So, what do you think we should? Do you think we as nurses should do that, or
It's a difficult, because part of me would want to just say what they wanted to hear because it makes them feel better, even though I don't believe it at all. But part of me does wants to be a little bit more true to myself, that just to, but in the same token, it's not about what I believe and my feelings, it's about their feelings. But in the same, if I was a Muslim with a wrap on, they probably wouldn't ask me to do that because they would assume that I was a different religion, and then they wouldn't ask me that. But since I'm live in the Midwest and I'm white, they'd probably assume that I'm Christian, so they don't feel bad asking me that. So if I say that I don't want to because I'm not religious, it's just like perhaps a shocking thing for them, and maybe they aren't that surprised or whatever. Maybe they're one of those people who has atheists in their family, and they're fine with it. Or it could go the other way and really upset them, and then they fire you and you have to switch with somebody else and get a different nurse, and it just causes a whole thing. And then everyone will know in your unit if you haven't come out to tell your coworkers, but you tell this family that you don't want to participate because you're not a believer, and they get upset and they want to trade nurses, and they don't want you to take care of their family member anymore. People are going to ask why. So then you're going to be outed to your whole unit that you're not a believer.
uh, you know? So I actually in one of my first interviews with Art Raw, I actually got that question in the comment section. So I'd be curious how you're gonna answer this. I think I have it here because I was planning on asking your opinion on it. It's like, okay, so this person, and I'm gonna leave their name blank. They asked, well, how hard is it? He said, how hard is it to just say what the patient wants to hear? And plus, when does this even come up anyway as a nurse? Do you go into the patient's room and say, hey, I'm here to change your sheets? But let me tell you about me being an atheist. So first of all, my response is, do you really think my job is just to change the sheets? And it's like, congratulations, you don't know the nursing field at all.
That's funny.
But so what do you say to that?
I think if I was really put in the situation, I would try to defer to someone else. We always have a chaplain available because we're a big enough hospital to keep one staffed. So I would just refer to that I could have the chaplain come and be with them in that thing. I'd probably just try to deflect as much as possible. And if they insisted, I'd probably just go along with it.
So I don't know if so tell me if you agree or disagree on this. I think chaplains are in a weird way overutilized in the hospital setting. Don't get me wrong, like I've worked with chaplains I like and some that I've talked to, who knew I was an atheist. But I've always find that in hospitals, chaplains are in charge of the ethics committee. And it's almost like the patient's struggling with and family member are struggling and they're secular. Hey, let's just call it the chaplain. And even then, I've had a chaplain tell me that this patient's agnostic. I've tried to talk to him about faith. It's like, well, why are you talking to him about faith?
What is that going to help? What is that going to do?
Exactly. And so do you agree? Like, I think the chaplain, I don't know why we just think like, okay, the chaplain should be in charge of the ethics committees. I see that at every hospital I've worked at, that has always been the case. The chaplain's in charge of the ethics committee. And I don't understand that.
I think that falls into the notion, the misguided notion that you cannot have any morals if you're not religious. So obviously the head of the ethics committee has to be religious, and who better than a chaplain?
Definitely. Now let's now for that. All right, so we see that we talked about that nurse, like what they could do at the bedside. They have that hard situation of where they could either be fired by the patient or be told or be put in a position that they're uncomfortable with. I've also there's also that nurse that which I find this situation easier when the nurse is just told asked by the family, are you religious? And they say no. It's like, well, I hope this brings you to faith. I kind of find that I actually have had that situation. I find it a little bit more easier because it's just like they're not overly antagonistic.
Okay.
So
like that.
So but how do we deal with this situation though? So let's just say that atheist nurse is working in a religious hospital and being asked to pray. So the religious hospital I worked at, each nurse every different time would be their turn to say the prayer. And this was a Christian hospital. So what advice would we give to that nurse who's being asked to say the prayer and read the Bible verse?
I have a thought. If it depends on the unit and how open the management might be to you saying no. But it's probably really important that we come at this type of situation with kindness and not being antagonistic and aggressive and whatnot. Just something along the lines of, I appreciate you including me in this. I prefer not to pray. So I would rather this be passed on to someone else who prefers to do this or something along those lines. Unless your particular unit or your management or the whole hospital's culture is just really centered on it, then you might need to consider if that's going to put you in a bad position, or if people are going to think ill of you because we're not religious. If it's going to put you in a position where you're going to get treated poorly by your coworkers or by your management. But I would think that saying it in a respectful tone and just, saying, thank you, I really appreciate that, but I would prefer not to, and move along.
So I think that that's a really good advice. Now, what about though whenever it is I did come out and say that now my coworkers are treating me differently, and my management is just like being different around me.
It's so hard to know what to do in that situation, because you could try to explain your worldview and you could try to explain your reasoning, but not a lot of Christians even want to hear it. And that doesn't apply to all Christians, of course. And some will be willing to hear you out and say, okay, and, still think you're wrong, but move along or whatever. You might just have to look for a different job. That's not great advice, but I guess it would depend on how, if people are really treating you differently, giving you bad assignments, would going to HR even do anything? Maybe, probably not. I just have to document what's happening and hope that it gets better, or go to management and make a statement and just, I just prefer to keep my, I don't even know how you could say it. I prefer to keep my private conversations private in that setting and just kind of be real vague, like my private conversations with God. But just, I just don't like saying that in front of other people or whatever.
Definitely. I think that's actually really the best. That's really the best option. Unfortunately, it is hard to come out, and I'm glad you pointed out it's not all Christians. One of my closest friends, she's the guide mother, which humanist godmother. She's a devout Christian. She's the guide mother of my son, and so she's very much open to me being an atheist. However, it is for the non-religious and secular humanists, it is. I don't think people understand how hard it is for us. One, because we feel the same pain, especially during COVID, that everybody else has felt, and we don't have that real comfort of. Well, we don't have that same support. We get our own sources of comfort, but we don't have the same support of going to the chaplain and be like, why is all this happening? Why did this young patient die and everything like that? And that's one of the reasons I started this organization was, and things that you and I are planning on working on as far as getting that support group and finding places where secular nurses can be united, is because there's such a need, there's not really, a lot of these nurses don't have that support.
Yeah, I'm hoping that that this can broaden into a good support group for all of us. And I know that I have some people in mind that would like to get involved, and especially in an ICU setting. And it's like all nursing is difficult, but ICU sees a particular amount of death, and COVID was absolutely no exception. I was fortunately not there in the beginning, in the worst part, but I joined in the last fall, so I took care of that second wave, and we had a little bit more of an understanding. But before, it was two or three deaths a day, 4 or 5 deaths a week, whatever. It was just insanity, and it was just grasping at straws, not knowing what to do and how to help these people. And some people can turn to their religious figure and you know, like that course description, why do God's people suffer? It's like, well, everyone suffers. It's not just God's people that suffer, but you know, they can turn to them and seek some understanding and do some mental gymnastics and find something that makes sense to them. Whereas we don't have that. We just have science. The fact that the body is overwhelmed with infection, with virus, with whatever, and we couldn't save them. That's hard to accept.
Definitely. You know, and I'm looking forward to working with you on this. This is really, I know it's going to end up being something great. You know, so now, so do you think, so now I kind of wanted to just the last part of this, and that is, what can we as the secular nurses, and should we be reaching out to our lawmakers and lobbying and making our voices heard for, and not just nurses, healthcare workers, doctors, other people, because, you know, unfortunately, the Supreme Court did set a precedent, even though it hasn't happened yet, that nurses have been fired for that ministerial exemption issue.
Mm-hmm.
I'm not sure if it's happened yet. I foresee it happening. And so do you think it's important that nurses, as hard as it is, speak up? Like, you know, as hard as it is, like, you know, say out, like, you know, look, I'm not religious, I'm not a minister, no matter where I work, I'm a nurse, I'm a doctor, I'm a tech.
Mm-hmm.
Do you think that that's important?
Absolutely. And I feel like going to my hospital system that I work for recently purchased a Catholic hospital. The one that I briefly worked at, they have purchased it now, and they're keeping their religious affiliation, which upsets me because, you know, I don't really think that religion has a place in healthcare from the administration side. So I don't work at that hospital, and I probably won't. But I feel like if I were in that situation, I would reach out to the bigger corporation and express that, you know, that this doesn't follow my values, and it's putting me at risk for you know, being fired just for having a different view. And not all of the other hospitals in this system are religious, so I don't see why this one needs to keep its religious affiliation, even though the other health system hospitals don't. If it's more of a network of religious hospitals all together in one system, it's probably more important just to lobby to lawmakers and governors and whatnot to not allow this kind of exemption to creep its way into the hospital setting, because the non-religious population is growing and people are still nurses whether they have a religious affiliation or not. So it's not something that's just gonna not be an issue. It's gonna be an issue. It's gonna come up. It has to come up because it's just the law of numbers, right?
Definitely. You know, I 100% agree, and I think we all need to definitely speak up, because, you know, like you said, we are growing. It is becoming it is gonna still be an issue. All right, well, I think we'll end the chat here, but it was definitely good. I'm looking forward to our next episodes.
One more thing I want to mention about religious hospitals, that it's not just the patients that are affected by the religious constraints. You know, religious hospitals don't perform sterilizations or abortions or provide birth control or whatever, but they also don't provide those to their employees. If I wanted to take that hospital's insurance, I'd have to pay out of pocket for my birth control, and I couldn't pick it up at the hospital pharmacy. And that's just par for the course, I suppose, for a religious facility. But the thing that I found interesting was that they had a thriving plastic surgery department. And That doesn't make any sense to me. I'm not allowed to decide when and if I have a child, but I can have the biggest Brazilian butt lift I could possibly squeeze into my body, and that's fine. So there's many facets that come along with being a nurse, and it's not just providing care, it's providing care for yourself. And and where does the line end with that? If I decide to have a child and I'm not married, can I still deliver at that hospital? Where does it end? Where does it end? And I brought that up when I worked there, and they were like, well, it's not that bad. And you knew this when you got here, so if you don't like it, don't work here. And I was like, winner, I will not. And also those nurses are now that they're being bought by our facility now, so it'll be better, but they were significantly underpaid. Like, I think I make $8 more than them.
Wow.
And I'm 30 minutes away. So that's just like, so you can do the Lord's work for less money, I guess, but that's just another thing to think about, is that you can get through the patient care and you can get through the praying with the patients and whatnot, but then you go home and you have to pay $80 a month for your birth control, or you have to go to an out-of-network hospital to deliver your baby, or whatever the case may be. But you can get lip filler and you can get the facelift, and that's no problem.
Yeah, that's insane. Like, and even think about like LGBT nurses and other things, that must also be hard.
Yeah, absolutely no gender affirming surgeries being done there. Wow. And the current hospital I work at, although I don't think that they are quite there as doing gender affirming surgeries, but there's a thriving LGBT community, and plenty of people have, ally related stuff outside of their office doors and whatnot. So it's very open, and many people take advantage of the community that's brought in by just by the people who we work with. And it's not anything to try to hide, because the chaplain is around the corner and whatnot. It's not anything that we keep secret, and it's very open. And I so appreciate that for my coworkers who need that kind of support.
Definitely. Well, for our listeners, I definitely, if you have any affiliation with a religious hospital, whether you work as a nurse, tech, doctor, please comment, ask your questions, and we definitely would love to talk to you about it, and bring your questions up. And even if I'll leave my email if you're interested in even being on the show and talking with us and giving your point of view. We'd love to hear about it. Mm-hmm. Like I said with Jonathan in our last episode, if you disagree with us, please give us your opinion in a respectful way, and we would even be happy to discuss your point of views here. You can maybe even come on here. Mm-hmm. So, as always, Humanist Healthcare is a 501c3 nonprofit. The link to our PayPal is located on the channel, along with a link to our Facebook page and our website. So we will see you guys here next time, and talk to you guys soon.